This is a story of Sami's big adventure and his return to health.
Come here, Sami. Come here, baby.
Sami arrived on a cold, dark night at All Creatures Every Spine.
He's not even himself.
He was,
not even here. He's not checked in.
for all intents and purposes,
not
very responsive.
Come here, Sami. Come here, baby. Come on. Come on. Come on. Come on. It's
The doctors examined him and found that he had several subluxations. A subluxation is a place in the spine that can be caused by trauma, toxins, and thoughts that alter how the nervous system responds to the environment. Sometimes we think of it like the electrical circuits in our home, and once in a while they trip a breaker. The electrical stimulus to those things that are attached to that breaker stop working, and we have to go back and find where that issue is. Once we can turn the breaker back on, then the electricity works again. In the spine, it's very similar to this, although sometimes it takes some time for the electricity to get back to the area that it is needed the most.
So, right now, his right leg
Just
is
turn his head
shorter
that-
than his left.
In this
So
video,
if you
we
will
can
turn his head
see
toward the
that
table,
Sami's
toward that
legs
direction.
are not of equal length. And when we turn his head,
and
they
then if you
change
can turn his head toward the
length
wall
and
or
size.
to your right, left.
Okay.
All right, now you can relax.
Once his subluxation was localized, which it happened to be in the first cervical vertebrae, the one that's right behind his ears. We adjusted it, and then we rechecked him for further subluxation.
Okay, now I have his feet. Now
In this
turn his head
video,
to
we see
the
that as
wall.
we turn his head from side to
Either way, I
side,
don't care.
his legs don't move.
Okay,
they
and then
remain
turn his
the
head the
same
other
length.
direction. Okay, now I have his feet. Now
This meant that we had found his primary subluxation, and it was resolved for now. But it was clear to us that he had become weak in the muscles and that his episode that had happened to him was the last straw for his body. In other words, he'd had this going on for a while, but now he was showing us that it was going to take him some time to heal.
Just so you know,
wait, let her call.
Sami.
Even
Come here,
after the
baby. Come
subluxation
here.
was
Come on.
removed,
You can do it.
he
Come
was
on.
still unwilling
baby.
to respond
Because I'm thinking about
to
it. at
his
least.
owner. The choice was made to leave him with us here at A.C.E.S. Many owners at this point would have said, my dog is really sick and I can't handle this. I don't want to take him to surgery. Maybe the best choice is to euthanize. But Angela Fries made the decision that she would rather have her dog have a chance at becoming well. And so she left him with us for the duration. This video shows how he was responding the following day. Definitely better than he had the night before, but still not interested at all in getting up or moving. He'd lost some interest also in eating.
She's happy that you're feeling better, I'm sure.
Several days went by as Sami rested and recovered, and on the
You ready to go
7th
outside,
day,
Sami?
he began to
You ready to
look
go outside?
very much better.
Yes. He
He
says,
had
I'm
an
starting to
interest in
stand
things
up.
going on
I'm
around
trying.
him.
I am
He finally
definitely
began
off the
to
ground.
stand up a little bit on his own,
Good boy.
and he would tell
Come on,
people
buddy.
that he
Let's
needed
go.
to go
Let's go
outside.
for a walk.
A week after Sami first arrived, he actually began walking again on his own. He was still not entirely able to use his hind legs, but he was definitely interested in moving and getting out to move around. One of our biggest concerns about dogs like this is that they have a tendency to have hyperesthesia or itchiness in their toes as they regain their strength. This means that sometimes they will begin chewing on their toes to the point of amputating them. This requires careful monitoring to be sure that that's not what is happening. Luckily, Sami did not have this complication. However, we still monitored him around the clock or placed him in a position where he was unable to reach his toes so that this wouldn't happen. Each day his walking improved. Using both legs more often and placing his feet correctly was a great big win.
Come on.
Let's go, Sami.
Come on.
Let's go. Come on.
He also seemed to have more interest in coming to the camera than in walking away from it. But in this video we can see that he's beginning to place his feet and use more like he should. He began improving so fast that he was even better in the same day. In just 4 days, by January 18th, he was walking and was steadily improving, but he wasn't perfect yet. He began placing his feet more appropriately, but he also knew that he was weak and so would often hop. This lets us know that there's still some healing to go, but definitely huge improvement to what he had been doing earlier. The doctors did another leg length exam and adjusted his atlas again. On leg length exam, his left leg was shorter than his right leg, as is evident in this video. We found it's difficult for the two of us to handle the dog,
I know,
do the
Sami.
exam, and
Your feet
videotape
are
at the same
crooked.
time.
The left is
And
short.
so some of the video is not exactly perfect. This is how he moved after his adjustment.
Come on. Come on.
After the adjustment, his legs were even and there were no changes when his head was moved. When he was ready to go home, he had finally achieved the ability to climb stairs, go over low cage entries, and walk pretty much anywhere he wanted to go. He still can be tired out by the end of the day, which means he sways a little bit. But when he's rested and excited, he will fly. That doesn't mean that he flies perfectly straight. He sometimes actually knocks himself over. But his road to recovery has been very long and arduous, and he's doing a great job. We would not consider him to be in any pain at this time. He still has muscle weakness. We really thank you for entrusting Sammy's care with us. He's on the road to recovery. Please be patient. He still has a way to go, but he has come a long way from when he arrived 2 weeks ago. Most owners would have elected to euthanize him on the day that you brought him to us, but he's made so much progress, it would be very sad to backpedal or try to do things that might make him worse. Please keep up the instructions as detailed that were given to you in the invoice so that he can continue to heal on his schedule, not ours. The adjustments that we recommend are small, not big, because we want Sami to be able to heal and remove waste products at his level, not at one that we hope he will make. Thank you so much.